Well, now we're going to talk about first aid for snakebite. And unfortunately, there have been a lot of bogus or detrimental snakebite treatments recommended. And the biggest reason for that is because a few minutes ago, if you remember, we were talking about the fact that most snake bites are survivable. So if someone does a first aid treatment and then they survive, they think they survived because of the first aid treatment, when in actuality they would have survived anyway, and the treatment didn't have anything to do with it. And unfortunately, a lot of things have been put forward that really don't help the situation at all, and some of them may make the situation worse for the victim. And you got to remember, if you take the first aid course given by the Red Cross, or really any number of them, the first rule for first aid is, first you do no harm. So you don't want to do something that's going to hurt yourself or the person who's bitten. And first off, I'll just say, here in the United States, the only first aid for snakebite is a set of car keys. Have somebody drive you to the hospital, or call an ambulance, call 911 and have them take you to the hospital. That's really the only thing you can do here in this country. Some of the poor first aid techniques that have been put forward, you may have heard of these before. The first one is to use a tourniquet or some sort of constriction device. And that's not a good idea because most snake bites in this country cause a lot of swelling. And if you put on a tourniquet, first of all, it's difficult to put on a tourniquet properly unless you're a trained medical professional. And if you put on a tourniquet and then there's more swelling, you're going to completely cut off the circulation to the limb that's bitten. And that's not a good thing because, first of all, without circulation, your tissue can't survive. And so you could end up losing the limb just from loss of circulation. And second of all, tourniquets have also been shown to increase necrosis or tissue death in the area surrounding the bite. So that's really not a good idea. Another thing that you may hear from time to time is to make an incision over the wound or try to bleed out the bite site. And that's not a good idea. The biggest reason why it's not a good idea is because many snake venoms have anticoagulants in them, which keeps your blood from clotting or causes it to clot improperly. And so making an additional injury, an incision or a cut of any sort, is just making the situation worse. You're just going to increase the bleeding and increase your risk for infection if you do anything like that. Another thing that frequently goes along with cutting is using some sort of suction. You know, the old cowboy movies where the guy's got to suck the venom out. And the biggest reason why that doesn't help, first of all, you've made the cut, so that's a bad idea. But doing any sort of suction really is completely ineffective because snake venom has hyaluronidase in it. And hyaluronidase is a carrier molecule, and sometimes it's called binding factor. And basically what it does is carry the venom toxins into your system, and it actually can attach to your tissue. So after the venom has been injected, it's stuck on you, or in you. It's a simplistic way of looking at it, but you're unable to suck it out. So that's not going to work at all. And the last thing that I'm going to discuss that you may have heard before is to use ice. And that's also not a good idea. Ice is a vasoconstrictor. And so what you're doing is you may slow down the circulation initially, which may seem like a good idea, but it tends to cause the venom to actually spread more once your body increases the circulation to the cold area, which is what it's going to do. So it also has been shown to increase tissue damage at the site of the bite. So once again, don't try any of those first aid techniques. Just get yourself a buddy or a paramedic to drive you to the hospital, and that's the only thing to do if you're bitten by a snake here in the U.S. There is one first aid technique that can be used on highly neurotoxic bites. And it's important to mention, before I even tell you what the technique is, that it should only be used in cases where the species of snake is known that did the biting, and only when that particular species has been shown to have a very highly neurotoxic venom. And what I mean by that is that the venom has been tested, and according to that test, there is a very high percentage of neurotoxin, and the risk for having a very quick reaction, which is 15 minutes to half an hour, is high. And you are far away from a hospital, or at least longer than that period of time away from a hospital. And this technique was developed in Australia by Dr. Sutherland. It's frequently called the Sutherland technique. And what you do is if the bite is, for example, on the hand, you take the arm and straighten it, and you wrap from the wrist past the elbow with a crepe bandage, or like what you would, an ace bandage, like what you would use on a sprained ankle, and you basically wrap it about the same pressure as you would for something like a sprained ankle. You don't want to wrap it really, really tight and crank down on it, and you want it to be not really loose and gappy either, so somewhere in between. But you should be able to put your finger gently underneath it. And what that does is impede the lymph flow. Most venom actually travels through the lymph system, not the bloodstream. And that just slows down the absorption of the venom. It doesn't prevent the venom from being absorbed into the body, doesn't prevent it from moving around, but it does slow it somewhat, and it may buy you some time to get to the hospital and get treatment. It's also important to note that if you are bitten by a snake that has other myotoxins or cytotoxins, lots of digestive enzymes in its venom, using the Sutherland technique will frequently make the tissue damage or necrosis worse at the site of the bite. So it's not something to be used unless you're absolutely sure that it's needed. And identifying snakes all over the world is beyond the scope of this video, but just a cautionary note not to use it unless you're sure that it would be needed for that particular bite.